I would knock on the patient's door, wash my hands, apply gloves. Hello, my name is Hazel. I'm going to be your nurse for today. I'm going to do a head-to-toe assessment. Is that okay with you? All right, thank you. Could you tell me your first and last name? Okay, could you tell me your date of birth? All right, I'm just gonna reference that with your ID. Okay, good. Patient looks stated age, normal facial features, facial expression, no signs of distress, and and normal behavior. Do you know where you are? Do you know why you're here? And do you know what month it is? Okay, good. Patient's speech is clear, and patient is learn orientated ×3. Patient looks well groomed, good hygiene. Patient's posture is good with good mobility. Patient does not use assistive devices, and patient has not shown any signs of involuntary movement, and patient is symmetrical. I'm going to start off with your vital signs. Is that okay? Okay, good. Thank you. All right. I'm just gonna take your apical pulse. All right, and I would take that for a full minute. Okay, good. Patient's apical pulse is 82 beats per minute. Rate and rhythm are regular. I would say 2 plus. I'm going to now take your radial pulse. I would then take the radial pulse for a minute. Rate and rhythm are also regular with 2 plus. Patient's respiratory or breathing is 16 breaths per minute. And patient's oxygen saturation is 98, which are both within normal limits. I'm now going to take your blood pressure. Would slowly release some air so that the valve can go down. Check for when the needle moves. Okay. Patient blood pressure was normal. It was 120 over 80, which is within normal limits. I'm now going to take an oral temperature. Okay, oral temperature was 98 degrees. I would not take an oral temperature had the patient had any sores or lesions in the mouth or any mouth infection. I would then either take a temporal or tympanic temperature. Okay, sir. I'm going to start my assessment from the head. We'll work our way down, okay? I'm going to palpate and inspect your head. So let me know if you feel any tenderness. No? Okay, good. Patient's head and face are symmetrical. Patient said that they have no tenderness. The patient's scalp is intact, no signs of lesions, masses, or like bumps. bumps, and patient has a full head of hair. I'm now going to check your neck. Patient's neck is symmetrical, shoulders are even, trachea and substernal notch are midline. I'm going to take your aortic pulse, and I would do this bilaterally, one at a time. Aortic pulse is regular, written rhythm are regular, and it is at 2 plus. Now I'm going to check your lymph nodes. So I would start pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. All right, everything looks good. I'm going to now move on to the eyes. So I'm going to sit you up a little bit. Use my pen light. Patient's eyes are aligned and even. Patient's eyebrows are even. There looks like there's no skin deterioration or breakdown on the eyelids. Sclera is white with red veins, which is normal. No discharge or drainage from the lacrimal ducts, and the conjunctiva look good. No redness or irritation. I'm gonna now perform perla. It is a way for me to check your pupils. So just look forward. I'm gonna shine this light over your eye. Good. Good. Okay. Patient's pupils were equal reactive. I'm now gonna check. Could you look at the pen light? All right. I'm going to bring it inwards. Keep looking at it and outwards. Now, when you look at the pen light, do not move your head. Okay. I'm going to bring it to the right, upper and lower, down the midline, to the left, upper and lower, back to the midline. Okay, patient's eyes were accommodating, round, equal, and reactive. Patient's EOMs are within normal limits. Okay, I'm going to now check your ear. Okay, let me know if you feel any tenderness. Patient's auricle, labial, and tragus have no signs of lesions or breakdown. There's no drainage in the ear. I'm not going to test your hearing. So, are you able to hear okay on this side? Okay, are you able to hear okay on the other side? Good. I'm now going to perform the whisper test. I'm going to say something, and then you just repeat after me, okay? All right. 1, 2, 3. Good. And I would do the same thing on the other side. A, B, C. Good. Patient is hearing seems normal. I'm now going to check your nose. It doesn't look like the patient has any septal deviation, no nasal flaring, and patient nostrils look patent. I'm going to use my pen light to check the mucous membrane. Okay, mucosa is intact, no irritation. Now I'm going to check your mouth. Could you open up for me? All right, good. Patient's sublingual and buccal mucosa or membrane are normal, intact, no irritation. Patient's hard and soft palate are both intact. Could you say ah? Okay, good. Patient's uvula is midline. Patient's tonsils are absent. Teeth are patient's own teeth. They have no dentures, and there's no tooth decay, no tooth loss, or loose teeth, and patient gums are normal. All right. Patient breathing, mode of breathing is through the nose. Patient uses no accessory muscles to breathe. There's no signs of retraction. Patient is able to breathe well in supine, prone, and upright positions. I'm going to check for jugular distension. Okay, good. No signs of sputum or cough. Good. Chest is symmetrical. Okay, good. No signs of jugular distension. And I'm going to just inspect the extremities. Alright, extremities look good. No deterioration, no skin breakdown. Hair growth and color look normal and healthy. Nails and toenails both look healthy. I'm going to now take your capillary refill. And then I would just take these bilaterally. So that means I would take each capillary refill on each finger. And I'm just squeezing a little to see how the blood flow is in your upper and lower extremities. Okay, capillary refill is less than 3 seconds. Everything looks good. I'm going to palpate your chest now. Is that alright? Okay, I'm just going to lower this. And I'm going to palpate. Let me know if you feel any tenderness. Okay, good. Alright, I'm going to palpate your 5 cardiac lobes, if that's okay. Alright, aortic, pulmonic, nervous point, tricuspid, and mitral. Alright, no heaves or lifts. Patient, sorry, did that too soon. No heaves or lifts. Patient has no masses, no tenderness, no crepitus. Let's see. No masses, no tenderness, no crepitus. Okay. 5 cardiac. There's no heaves or lifts. And now, patient's chest. Patient's chest as a normal depth and not symmetrical, normal depth and symmetrical when breathing. I'm now going to auscultate your lung sounds, if that's okay with you. And palpating, I would palpate anteriorly, posteriorly, and laterally. Okay, I'm going to listen to your lung sounds using the ladder method. Breathe in and out. 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 Okay, breathe in and out. And breathe in and out. Good. Your lung sounds are clear. I hear no crackles or bronchi. Keep trying to lift your shirt. I slammed it down. I'm sorry. Lung sounds are clear bilaterally. No sounds of crackles or bronchi. And they sound normal. I'm now going to listen to your heart sounds, okay? Alright. Okay. I'm going to start with the second intercostal for the aortic. And then I'm going to listen to the left-centered second intercostal for pulmonic. Third and left intercostal for Erb's point. Fourth intercostal for tricuspid. And fifth intercostal for mitral. Good. Your lung sounds your heart sounds are regular, yeah, right in rhythm, and I would say they're 2 plus. Okay, do you, okay, now I'm going to, now that I've done listening to your heart and your lungs, I'm going to look at your abdomen. Okay. All right, abdomen looks um, round and normal, symmetrical. No, doesn't look like there's any masses, no lesions, no pulsations noted, and umbilicus is midline. Um, no pulsations, no lesions, no. Um, umbilicus is midline. Okay, good. And I'm now going to. No, wait. Oh, okay. Sorry. Abdomen is symmetrical and round. It doesn't look like there's any masses or lesions, no pulsations. Um, no pulsations. Oh, okay. And I'm going to now check your extremities. I'm going to check your extremities for your pulses. Let me just move this back down. Okay, thank you. I would take your radial and your radial pulses bilaterally. I would take your femoral pulses bilaterally. I would take your popliteal pulses bilaterally. I would take your post-tibial pulses bilaterally. I would take your dorsal-pedal pulses bilaterally. Okay, good. Extremities are one to touch. There's what's it called? Pulses are regular, rate, rhythm, and force at a 3 plus. I don't want to get ahead of myself. Your genitalia looks normal, no signs of skin breakdown, no discoloration. I see no sign of discharge, and there's no lesions. Patient's urine was clear and yellow, and patient's stool was formed and brown. I'm now going to palpate. No, I'm now going to listen to your stomach, your bowel sounds, okay? Alright. I would start with the right lower quadrant and right upper quadrant, left upper quadrant, and left lower quadrant. Good. Patient's bowel sounds are active. I'm now going to palpate. Let me know if you feel any tenderness. Okay. Good. I palpate lightly. Alright. Patient didn't feel any tenderness. There was no masses. No pulsations. Now I'm going to check your grip. Could you squeeze my hand? Okay, good. Squeeze this hand. Good. Patient's upper extremities are good. Strength is bilaterally or symmetrical. Could you push on my hand with your foot here? Okay, good. Could you push on my hand with your foot here? Good. Patient's lower extremities are strength is good and symmetrical. Now I'm going to do your range of motion. Okay? I just need you to bring your arm out for abduction, in for adduction. I need you to extend it over for extension, or flexion, and back for extension. Could you turn your arm down for pronation and back up for supination? And now could you just turn your arm in a circular motion? Alright, good circumduction. Patient, range of motion is good. Motion is good. Would you, do you need anything else right now? No, okay. I'm now done with my head to toe assessment. I'm going to give you the call light. Okay. And raise your handrails. I'm going to lay patient back in a comfortable position, and I will be back to check up on you in 30 minutes. Okay? Thank you.